huge dogs or large to giant breed dogs, and they're really great for decreasing pain, improving quality of life, and they are actually the only bed that I know of that has like a scientific study behind it. So I'll just share that now, and then we'll get on to the main topic. And Gwen said her dog loves hers, so I know Hannah's got one as well for Luna, and Luna loves hers as well. So that's a big thank you to Big Barker for sponsoring CAM and being a huge support to us. But now moving on to the main topic, I would love to introduce Dr Gwen Covey-Crump, and I'll pass over to you, Gwen, to sort of give a little bit of an introduction to the wonderful you and what you do and how you got into sort of the pain management anaesthesia field.
Yeah, okay. So I graduated in 2001, right in the middle of foot and mouth.
Wow.
Do you remember that? Which was an interesting time to graduate as a vet. But I went into small animal practice for 3.5 years, I think, and really enjoyed it, but realised that I didn't really feel like I was very good at anything. I think general practitioners are very good at a broad range of things, and I find it really difficult to be very good at a broad range of things. So I decided I want to specialize in something, and the natural course of events, really, because I did an anesthesia elective as a veterinary student, and I decided that I was going to be an anaesthetist. So obviously this is anesthetizing animals, inducing sleep and pain relief, and the conditions for surgery, for example, and other procedures that we need to do for dogs and cats, because we can't ask them to lie still and put up with some of the things that humans put up with without anesthetics. So I decided to be an anaesthetist, and from there I went through a residency training, a specialist training, and became a specialist. And then I decided I'd like to specialise further, and actually decided to concentrate a bit more on chronic pain, because I felt it was a really unmet need within the profession. So I now I work part-time for my employer, and I spend 2 days a week being an anaesthetist and 1 day a week running a chronic pain clinic with a team of physios, a great team. And then in my other hours, when I'm not working for my employer, I'm doing all sorts of things like stuff for CAM and stuff for other organisations to do with my professional role, and that sort of knowledge and interest I've developed in chronic pain. So that's a bit of an introduction to me, maybe not short enough, bearing in mind we've not got much time tonight.
No, it's lovely. And it's, it's one of those fields which I think has still got so much more to find out, hasn't it? In a lot of ways. So, and it's changed a lot over the course of the last years. So if we dig straight into the topics, we've got a lot to cover tonight. How can we approach working alongside a behaviourist and a vet? So, Gwen, in your experience, have you had any experience working alongside behaviourists with your pain clinics?
Yeah, well, I think I started off actually as a GP vet back in the early noughties, working with behaviourists, because I realised as a vet, I just didn't have the depth of knowledge I needed to guide my clients through some of the issues that they were having with their pets. And actually, one of the receptionists I worked with in my first job is a well-respected behaviourist down in Southampton, and she was doing her PhD at the time, or about to, and she influenced me right at the start. And then I worked with behaviourists as a general practitioner, and realised how important it was to keep that two-way communication open about your patients. So I really quickly learned that I needed to practice within my competence, and I wasn't competent actually to deal with some of the behaviour issues that we see. And at that point, I don't think I really had an understanding of how pain affects behaviour and how often pain goes undiagnosed with behaviour problems. So once I started working more in chronic pain, that became more and more obvious to me. And I started to get referrals from vets that had been bullied into referring animals by the behaviourist. But really frequently, that behaviourist had been approached independently by the client. The the dog or the cat owner, rather than by the vet. So,
Yes.
and what I'm seeing now increasingly is that vets are actually keener to work with behaviourists, but there's still reticence quite often to refer animals to a behaviourist. And I'm not really sure why that is, because I thought most vets were really happy to hand an animal over that had a problem that they couldn't really deal with from a behaviour perspective. But anyway, seeing these clients which had approached their behaviourist independently, and then obviously the behaviourist has to go back to the vet to say, I've been asked for this. I've been asked to look at this animal. I need a referral from you. And so then that relationship's been established between the vet and the behaviourist. And then if they come to me, I'm really keen to reinforce that relationship between the vet and the behaviourist and the client, because otherwise what I see quite a lot of is the clients working with the behaviourist quite successfully, but they're having to go back to report to the vet what they're finding, and there's not that sort of three-way communication quite as there should be.
Yeah, I think that's definitely been my experience from a general practitioner point of view, is that I definitely haven't had, I've had one successful case where I had a really good relationship with a local behaviourist, and since then I think I moved, and so I haven't really found anyone in this area to work with, and so it has been a lot of the owner-led, interestingly.
And I think now in the last couple of years, good behaviourists have become so busy, it's actually really quite hard. So we need to know how to find a good behaviourist, and then somehow get into their books. And I'm really hoping that the number of certified behaviourists builds, because there's a real shortage in capacity, and those that are there are overloaded in my experience. So I think we need to, so looking for a behaviourist, I think that was one of your questions.
Yeah, so my next question was, it isn't a protected title.
Yeah.
And there's a lot of dog trainers that sort of dip fingers in the behaviour field, but that might not necessarily have the accreditation that means that they've done the exams or the course that means that we have sort of like a level playing field of skill as such. So it's been...
And there are, and there's some excellent dog trainers out there.
Yeah, there is.
But quite often the level of training is not guaranteed. So if anyone can call themselves a dog trainer, and it's very easy for that to slip into calling themselves a behaviourist, because it's not a protected title. But there are ways that you can actually find, there is an association where you can actually look up what the different titles are for the certified sort of clinical animal behaviourists, and even find a list in your area. So quite often, if you just Google animal behaviourist, you will see all sorts of dog trainers coming up, and they will probably be great. But what they need to be able to do is, when they look at your animal, if they realise that the animal has a behaviour problem which is outside of their capabilities, they then need to say to you, actually, you need to see a certified clinical animal behaviourist, for example. Well, you need to go back to your vet and ask to see a certified behaviourist, because they need to practice within their competencies. But because they're not regulated, then that's a bit variable. And I do wonder sometimes if that's where the relationship problems are, because they're not regulated. They're also not necessarily writing reports for the vet and things like that, and requesting referral before.
And not necessarily even aware of that's even a possibility, or so it's tricky.
And why is it really important that a behaviourist asks for a referral from a vet? Because from my perspective, one of the main things that you need to do is make sure that there's no pain present, because it's such a common problem with behaviour problems. And a certified clinical animal behaviourist is going to ask you to have your vet examine your dog before they even see the dog. And then quite often, if they go on to suspect pain where the vet hasn't, they will send the animal back to the vet saying, I suspect pain, please can you look at this? And that's the point at which the vet goes, oh, I'm going to send it to a specialist because I can't see the pain. And that's genuine. I think in the consulting room, you can't see chronic pain.
Yeah,
And
it's
that's
very,
something I
very
see an awful lot. It's really difficult to diagnose chronic pain in the consult room because animals are totally inhibited in the consult room, or if they're happy in the veterinary environment, they're just really happy to see you, and you can't see their chronic pain. So the person who sees the animal's chronic pain behaviour is the owner, and then subsequently potentially the behaviourist who sees the animal in their home environment or out in the field, and they see them several times in a more relaxed environment than the veterinary surgery.
absolutely. And that's, I don't know, do you get your owners to take a lot of video footage? Because that's what I do, because it's the only way that I can see some of these behaviours and actually understand what it looks like in practice. To make an assessment, really, a lot of the time in these more chronic cases.
So finding a good behaviourist, I recommend you can go to the website of, there's two main websites, I would say. So the Association for the Study of Animal Behaviour, the ASAB website, is where you can find a list of every certified clinical animal behaviourist or clinical animal behaviourist. There's two main terms. Basically, they're the same thing. They've just had different routes of qualification. So you can get a list there of all the people that are, regulated at that level, and they've trained to a certain level, and they are required by their membership association, which is the Association of Pet Behaviour Counsellors, the APBC. If they're a member of that, then they are required to undergo certain levels of keeping up to date with their training and things like that. And it also things like writing reports for vets, referring back to vets, making sure they've got the proper veterinary referral and all of that. So that's a really good resource. And really, you're looking for the behaviourist to have the post-nomials CCAB or CAB, and the main ones. And then once an animal's been seen by one of those clinical animal behaviourists, then there's also another title called ABT, which is an animal behaviour technician, and they can also be members of the Association of Pet Behaviour Counsellors, but they're there really to sort of maintain a behaviour routine regime and offer behavioural first aid rather than actually diagnose and actually look at the animal's emotional diagnosis and things like that. So I've just thrown loads of words at you.
Yeah. And that's why this is so great that it's recorded, because you can go back.
Yeah, you can go back.
Write down all of those letters, because I know I'm a bit I'm dyslexic anyway, so writing down all of those different combinations of letters is difficult for me. But you can watch this back as many times as you like and have a look at those websites, absolutely. And I can even include a link on the comments after the live as well, if that's helpful for everyone.
Yeah, okay. So what were we going to discuss?
Sort of move on to, we've sort of had a chat about what do we look for when we're looking for a clinical behaviourist, what kind of things do they do, but then moving on, just so that as owners we can have more of an idea of what we should be looking out for from a behaviour perspective that could potentially be pain, to sort of signal, well, actually I do need to go and see my vet and have a chat about that. So I thought we would sort of dig a little bit deeper into some of the more common pain-related behaviour that we see, first looking at acute pain and then moving on to chronic pain, if that's okay.
Yeah, okay. Well, I don't see many animals with acute pain.
Yeah.
Well, I suppose I do in the clinic, don't I? I see
I
in the anaesthetist, I see lots of acute pain, but acute pain is what most people will notice straight away, isn't it? Because animals are likely to vocalise, for example, if they suffer an injury. Not always, but quite often. But amazingly, they can suffer an injury and then sort of run off and behave like everything's fine. But it's usually pretty obvious fairly quickly that there's something wrong. So they will, they might be lame, they might be limping, they might be reluctant to move, resting a lot more, not wanting to eat and not interacting and things like that. And it's a really sudden change usually with acute pain.
Yes, that's definitely the easier one to sort of see, isn't it?
Yeah, and it might be associated with other sort of clinically obvious things. So, we see animals with spinal disc disease, what you might refer to as a slip disc, and they might have not only pain but weakness in their legs, or they may not even be able to walk, and that sort of thing's really obvious. And most people are going to seek advice really quickly about things like that. From their vet.
Yeah, and then the more difficult one to sort of get your head around or even realise is the chronic pain.
Yeah.
And it can be quite an insidious, slow onset as well, can't it?
Yeah. So chronic pain, acute pain, just look at it like this. Acute pain really is there for a reason. It's designed to remove an animal from harm, and that includes us as humans. Obviously, if we injure ourselves, we'll remove ourselves from the source of injury, and we will rest for healing to occur. And things like vocalizing type behavior is a sort of behavior which is there to seek assistance from your friends and your pack. So even acute pain behavior actually does vary. I didn't mention, does vary between species. So, for example, a bird that is acutely injured is going to behave very differently because it's a predated species to, for example, a dog, which is used to living in a pack, and pack members help each other rather than, even a cat is quite different from a dog in the way it's more solitary. So they can't always be sure of help from their fellow cats. So it's quite complex. We definitely don't have time to go into that tonight, but it does depend. It does range quite significantly on the species, depending on whether it's a predated species or more of a predator species. But chronic pain, definitely throughout species, it's a very slow onset usually, because it's usually associated with some sort of long-term pathology, and the perfect example is osteoarthritis. And so an animal learns to adapt with it over time. And it always amazes me that people find this so surprising, that a dog doesn't necessarily vocalize in pain, and they can't speak to you and say, oh, my back's a bit sore today. But a human with chronic pain, they don't necessarily vocalize all the time, do they? They might grumble and say, oh, my back's really sore today. But mostly what you're going to notice about your relative who's got really severe hip arthritis is that they move differently. They might groan slightly when they get up from the chair after a long rest. They might limp. But actually, most of the time, they just get on with it and don't complain. Dogs are no different.
It's absolutely right.
And particularly, again, depending on the breed. So a classic Labradors are really stoic, whereas some other breeds, I don't know, maybe Lurchers are a bit less stoic.
They pain more keenly, don't they?
I think it's really hard to notice these things, and as I said, in the consult room, it's really, really hard to detect it. And even if you go through, as a vet, you've got a dog in the consult room, you go through and examine all its joints, and you push and pull and twist and prod and poke, and the dog doesn't really say anything, and it's just everything is the same. And they might, if you're really, really observant, you might see a slight change in facial expression when you get to a sore bit. Or the owner might say, oh, I think she found that a bit sore because something changed about the dog's posture. But you need to be really observant to catch that.
Yeah, it's really difficult.
Because most dogs are just they get put on the consult room table and they just literally, I just want this to be over as quickly as possible.
Freeze. Yeah.
And everything is bad. So it doesn't matter if you hurt its sore knee, because everything's a disaster and they just want to go home and want it to be over and done with. So it's really hard to diagnose chronic pain and to localize it to a specific joint in the consult room. Not impossible, but it's really hard. So you're looking for owners looking for things like behavior change, such as less interaction, less playing with toys, less, maybe they don't get up to greet you when you come in. Or it takes them a while to get up and greet you. Or they don't fly to the door to greet the person who's rung on the doorbell anymore like they used to. Sometimes they wake you in the night and you're not really sure why, and you sort of let them out in the garden. They don't really want to go in the garden, and actually they're in pain. They can't sleep.
Comfortable. Yeah.
What else do I see a lot of? I mean, obviously you can see things like they might struggle with steps or stairs. Something I see a lot of is dogs throwing themselves up the staircase because otherwise they're not going to make it to the top, and owners just think they're being really enthusiastic. But actually and also sometimes they tumble down the stairs, and it's a lack of control and a lack of strength quite often, which has developed over time through disuse. We call disuse atrophy, where their muscles get weak because they're not using them properly and they're not as fit as they used to be. They might be less keen to go out on walks. They might ask less to go on walks, or they might stop halfway through a walk and say, actually, I want to rest, or I want to go home again. So those are classic chronic pain changes, and I'm talking about behavioural changes.
Yeah.
So they're not considered negative, are they, those behaviour changes? So
No.
we're talking about behaviourists.
Yes.
Working with behaviourists. So often these animals are presented to behaviourists because then the changes they're seeing are the dog maybe getting a bit more reactive with other dogs in the park, maybe snapping at other dogs that want to play with them, where previously they'd been very social.
Yeah, or even children in the household.
Children in the house, or the owners.
Yeah.
My dog that I had to put to sleep in 2018. Hannah's got a video of me grooming her, which she often uses as an example of, she was always happy to be groomed, but then I noticed over time she would start to sort of move away as I got down a certain part of her back. So she didn't like being groomed anymore, and that's not a negative behaviour, is it? But a dog that was previously happy being groomed now nips the owner when they try to groom down the back of the right leg. It might be something to look at. Noise sensitivity or noise phobias. So there's actually been there's been a study which has linked development of firework phobia, distress, noise. We talk about noise sensitivities and noise distress as a new thing, as an adult dog. So you've got the possibility, maybe they had a particularly bad experience, and my dog had a firework go off very close to her when she was out on a walk one day, and she was already quite stressed because I was walking her along a main road, and she absolutely hates traffic, and she was really terrified of fireworks from then on. But actually quite often we see this development of firework fear as a new thing without any obvious cause, and it has been linked to pain as a source of the problem.
Really interesting.
So we should always be looking for a source of pain in an older dog, well, even a young dog that suddenly developed a sensitivity to noise. And it can even be things like noises in the house. I've had patients that have been fearful of beeping noises that the dishwasher and the kettle make. The sound of the neighbour coughing, who has a particularly nasty cough.
Yeah.
Really odd things that you think, why is that causing them stress? And so you need to start looking for a reason, and actually pain is often underdiagnosed in these animals.
Yeah, Diane Clark just said that her dog has started reacting to some things as little as a knife clashing with a plate. That is quite a loud, high frequency noise,
Yeah.
isn't it? Yeah.
Yeah, but we should look for pain also as a potential cause. I mean, my dog got a bit scared of pans in the kitchen. But in a very specific context. It was in another person's house where she'd experienced a pan being dropped on the floor right next to her. And she's not fearful of pans in my house. So I don't think that's related to pain. But I think bashing pans around in the kitchen is quite a stimulus, isn't it? So
very similar to fireworks, I guess, in a lot of ways.
Can you think of any other things that I haven't mentioned? There's absolutely loads.
There's so many, isn't there?
Are there any comments coming through on the Facebook? I can't see it.
There's someone saying that their husky who's epileptic has cruciate issues and arthritis in his back legs, his knuckling. So she's bought him protective socks, but he's very stoic and doesn't show pain vocally or in his movement. But the main change is that he's slowed right down, which is what you mentioned.
Yeah.
Everyone else is just saying hello to us, which is very lovely. Hello, everyone. But yeah, it is. Oh, my dog has developed a noise phobia after having his first surgery for elbow dysplasia. He also suffers from osteoarthritis. He is absolutely terrified of my neighbour making noise outside my flat or someone knocking at the door. I'm actually trying to find someone to help me with his phobia as it's got so bad, and he empties his anal glands. Oh, bless him.
But always also make sure that your vet's checked that he's adequately treated for his pain. So obviously you've got a diagnosis of that specific joint being a problem, but it's quite possible that his pain is undertreated. And also the pain sometimes is not just in that joint alone. It can be what we call myofascial pain, which is pain in the soft tissues that if you get a painful knee, or if you injure your knee, and for any length of period you're having to limp, you get back pain. There's nothing wrong with your back, but because you're moving in a different way, you get this muscular tightness and muscular pain, myofascial pain, and that is often under-recognized. And you need to treat it slightly differently from just this sort of arthritis, inflammatory pain that the dog will have in the elbow joint. Just get him checked out, really, and maybe even ask to see if you can have a physiotherapist look at the dog, because actually physios are way better than most
That's another topic that we
uncomfortable bits. And I totally rely on my physio team to find painful bits for me, and I'm looking at animals with chronic pain all the time, and I still think the physios are better than me, way better than me at finding where the pain is.
Yeah, they seem to have these magic hands that just find where the muscle tension is, don't they? Again, Hills Cully has said she sees a lot of dogs while grooming or showing pain or aggression, and they send to vet, and the owner hasn't even realised that it is tension in one spot, or they've worked with the physio and it's really helped. And again, a few other people have mentioned noise phobias. Ella Pelk has said, that Ella is the lady that has the dog with elbow dysplasia. She said her dog's on Librela and Onsior. That kind of nicely moves on to what we were just going to briefly run through, because we don't really have enough time to go in any detail of the things that are available, because there's actually a lot of different pain medications and a lot of different pain pathways that you can target. And so often, you'll think, well, my dog is on non-steroidal anti-inflammatory, we're treating the pain, for example, but actually we might need to add things into that on top of that to deal with other pain pathways that perhaps aren't being targeted by that one drug. And so although NSAIDs are the mainstay of arthritic treatment, and do you still find that in that's the first thing that I always prescribe. Got a dog that I'm worried about chronic pain, and then after they've been on that, we will then sort of pain score again, and then think about, well, what adjunctive drugs can we sort of bring in to help perhaps give an even better quality of life, because we're seeing that actually we're not 100% comfortable here.
So anti-inflammatories are the mainstay of treatment, mainly because we've got so much amazingly excellent evidence that they work really well for inflammatory pain. And we're mostly talking about osteoarthritis, mainly because it's the most common source of chronic pain, also because this is canine arthritis management. And also we have something like 9 different anti-inflammatories licensed for veterinary treatment. We know about them, we know about their side effects, we know how to use them effectively. So they're definitely the first port of call. But now we've got these other drugs which have come out in the last couple of years, really. So Librela just came out last year. And that's targeting a completely different aspect of pain in the periphery. So periphery meaning the limbs, the joints, as opposed to the central nervous system, which is like the spine and the brain. So Librela is treating a different aspect, which is where if you've got an osteoarthritic joint, you've got an upregulation of receptors for nerve growth factor, which is a substance that's very useful in a young animal with growing nerves, and then also useful for nerve repair, but actually is not useful in a fully grown healthy animal. But they have this upregulation of these receptors in the joint, which causes pain in an inflamed joint, and so this Librela is acting to look at that pathway. So it's a separate pathway from the anti-inflammatory, so you're targeting it from a different direction. And then we've also got Galliprant.
Yes.
The drug is called Grappiprant, and I like saying that because Hannah Capon cannot say it. It's absolutely hilarious.
That's the next time I see it.
Grappiprant. But most people know it as Galliprant, and that is it's like an anti-inflammatory, but it's targeting a very specific receptor for prostaglandins, which is what's causing the the pain of inflammation. Is targeting a specific receptor rather than anti-inflammatories such as Onsior you just mentioned, and other drugs. Meloxicam has many different versions. Carprofen. There's loads of different. I'm not going to name them all now because I find it difficult to think of them all. But they are targeting an enzyme which produces prostaglandins. So some of the side effects we see with non-steroidal anti-inflammatories are not seen with Galliprant. So some dogs have gone on to Galliprant because they can't tolerate a non-steroidal anti-inflammatory. But also it is licensed as a first-line therapy. So your vet may well want to put your dog on to Galliprant as a first-line.
Absolutely. But my understanding is that sometimes it's not quite as effective, which is why sometimes we'll still think about Metacam and all of
so I think it's licensed for sort of mild to moderate osteoarthritis pain. But I have quite a few patients on Galliprant plus adjunctive medicines.
Right.
Those patients that can't tolerate non-steroidal anti-inflammatories, then we're using Galliprant plus some other medications to get superior analgesia. So even dogs with severe pain could be on Galliprant if they're on some of these other
absolutely
non-licensed human drugs that we use.
And shall we dig deeper into sort of what are the most common ones that you use from a non-licensed human perspective that you find helpful with patients that come through your chronic pain clinics? Is that okay?
I think the other thing to mention that's licensed that we use in an off-licensed fashion is Pardale.
Yes.
And Pardale contains paracetamol plus codeine, and it's a veterinary licensed product. So vets should be prescribing Pardale as a first line rather than human paracetamol. But we sometimes fall back to human paracetamol for reasons. Maybe we don't want the animal to have codeine, for example. But that is licensed for use for 5 days at quite a high dose. But I'm using it regularly at a much lower dose, a much more judicious, that's not the right word, a smaller dose that we feel is safer for long-term use. So that's using the licensed drug in an off-licensed manner. And that can be really quite effective. And actually, we can also use that at the same time as a non-steroidal anti-inflammatory in a dog whose liver and kidneys are competent. So that can be really useful to add additional pain relief. And then beyond that, we're then having to look into human drugs, which we are allowed to prescribe as vets, provided we have first tried the veterinary licensed drugs. And some of those are even licensed for different purposes, not just for pain in humans. So it can be a little bit surprising. So for example, a lot of vets now are familiar with a drug called amantadine.
Yes.
Or another drug which is called memantine, which is very, very similar. And I'm using a lot now because it's more potent. You need a lower dose. And that's actually licensed for treating certain types of dementia in people. And that's because it works on a receptor. There's two reasons. One, it works on a receptor that's involved with memory. That receptor is also involved with chronic pain, like a pain memory almost. It's also involved with dopamine in the brain, so that it's useful for certain types of dementia for that reason. And so if people go and Google amantadine after the vet prescribes it, then sometimes they get a bit of a shock. So always ask your vet to give you a little bit more detail if you're not sure about the drug that your dog's been put
we
on.
should be getting everyone to sign an off license form and go through that sort of stuff with them.
Yeah.
But it doesn't always happen in as much detail as perhaps would be helpful for some of these more.
But you can get, vets can get owner client information sheets, the equivalent of a patient information sheet if you get a medicine from a pharmacy for yourself. Vets can get hold of client information sheets for these off-license medications from the BSAVA. So a lot of vets are members of the BSAVA, and they can get these sheets which they can hand out to clients. So you can ask for these things. And I just caution the pet owning public about Googling things, because sometimes you come across things that are not really relevant. So by all means look it up on the internet, but just be aware that it's not a replacement for medical knowledge. So do consult your vet about it if you're worried, and ask them for more detail about how and the side effects and things like that, what to look out for. So that's probably my first port of call after the veterinary license drugs for a dog with osteoarthritis. It does take quite a long time to have its effect. Chronic pain takes a long time to develop. It takes a long time to unwind, and amantadine probably takes 3 to 4 weeks to really see an obvious effect. The next sort of most commonly prescribed drug for me is a gabapentinoid. So that's either gabapentin or pregabalin. And I think these are a bit overprescribed, or maybe prescribed a little bit more in a more relaxed fashion than maybe they should be. It is a controlled drug because it is a drug that's subject to abuse, unfortunately, in the human population. It's mostly a problem in the US, actually, rather than, I don't know how much of a problem it is in the UK. I really don't know that information, but it's controlled. So vets are only allowed to prescribe 28 days worth at a time, and the prescribing regulations are quite tight. But it's a drug which is more for treating nerve pain. But on the other hand, it is relevant in osteoarthritis because you will have had other Facebook Lives where we talk about chronic pain and sensitization.
Yeah, absolutely.
Where this pain that used to be useful pain to cause the animal to rest, etc., becomes much more amplified and even disconnected from the original source, so out of proportion to the actual pathology present, the actual inflammation that's present. And that sensitization is happening in the central nervous system, so in the spinal cord and in the brainstem, and that is treated by these gabapentinoids and by amantadine as well. And so the gabapentinoids are potentially useful in osteoarthritis, but the main side effects of them is it can be sort of weakness if they're started at too high a dose. And so I do occasionally see animals that they appear to get worse initially. So I always start them on a low dose and sort of titrate the dose up. And that's what I usually advise vets to do. So they're the most common ones that I reach for on an outpatient basis.
Yeah, no, absolutely. That's really helpful.
And are there any questions coming in about those drugs? Because we could talk for an hour about each drug.
Yeah. Sarah's just said we've answered her question. She was asking about gabapentin in animals that cannot take NSAIDs. If you've got an animal that can't take NSAIDs, would you add anything else in other than just gabapentin? Because from Sarah Collins, it says the use of gabapentin, especially in animals who cannot take NSAIDs. So, I mean, if that animal was coming in to see me, I would always make sure that they're probably on Pardel as first port of call.
Yeah, so both pregabalin, gabapentin, and amantadine, obviously that's a completely different class of drugs from pregabalin and gabapentin. They are what we call anti-hyperalgesics, and hyperalgesia means increased pain. So pain that's beyond the level it should be for the stimulus, if you see what I mean. It's not a very good way of describing it, but
Yeah,
it's pain that's increased out of proportion.
yeah, that
And
makes
so
sense.
these drugs are called anti-hyperalgesics. So they're designed to bring pain back down to a normal level, not to obliterate pain. So really, generally we don't use them alone. So if the animal can't tolerate NSAIDs, I would be recommending that they should be on maybe maybe Pardale, and maybe Librela or Galliprant as well, or Tramadol.
Yes.
So Tramadol is another drug which actually is licensed. I forgot, is now licensed. There's several licensed versions available. Again, Tramadol is a drug which is possibly overprescribed in certain circumstances. I think quite often we don't understand. Dogs metabolize Tramadol quite variably, and some of them don't get that acute pain relief from them, so they're not working like an opioid or an
because I think they're usually about 50% of the dog population it's effective in. Yeah.
But what most dogs will do is respond to them as an antidepressant, because they're having more than just an opioid effect. They're also having an effect on serotonin and noradrenaline, which are two key nerve transmitters, which are involved with pain management. So in that respect, Tramadol should be treated more like an antidepressant and needs to be given. And so Claire Rusbridge says they should be given, Tramadol should be given for at least 2 weeks to see if it's actually useful for a particular individual dog. Yeah. So sort of 5 days of Tramadol for a dog post-op. Some dogs will get pain relief from that, but some dogs will just get high, and other dogs will get no pain relief at all. So it's really important to follow up those dogs and make sure the vet needs to follow up and make sure they are getting the pain relief that they think they're going to get from it. But it can be quite useful for long-term pain because of its antidepressant effects, actually. So you can be using that in combination with the gabapentinoid, for example, rather than just using gabapentinoid alone. Having said that, I do think that a lot of dogs do get benefit from a gabapentinoid alone.
Yeah,
theoretically they shouldn't, but they do, in my experience. I'm trying to turn on a light so I don't look like I'm in a dark room, but it's not plugged in. My light's not plugged in, so you'll just have to put that with my.
I can still see you. There's quite a few questions sort of coming in. Someone's asked about acupuncture. Do you think acupuncture as a complementary treatment for chronic pain post-surgery is useful?
Yes, I think acupuncture is a really tricky one because there's not a lot of evidence to support it. The problem is it's a very subtle therapy, and it massively depends on the person treating, the acupuncture points you use, the response of the individual animal. It's really hard to do good research on acupuncture because it's almost impossible to sort of standardize it, and it's certainly impossible to blind it. So in research for pain relief, we like to have a study group that's given effectively a placebo and a study group that's given a treatment. You can't do that with acupuncture, really, honestly. Lots of people have tried to create sham acupuncture. But there's good research evidence at a lab animal level to say that acupuncture does cause improvements in blood flow to the tissues, release of endorphins, which are the body's own painkillers, relief of myofascial tension. So people talk about trigger points and knotty muscles and myofascial pain. It's really useful for myofascial pain in my experience. Electroacupuncture is where a lot of research has been done to indicate that the body's opioids are released when you do this treatment. So I do think it's useful. I don't think every animal responds. So I would encourage most people to try sort of a course of 4 weeks, weekly sessions, before they decide whether they want to carry on or not. And often it takes, remember I said chronic pain takes a long time to build up, it takes a long time to reverse, and that applies also to using acupuncture to treat chronic pain. Treatment of acute pain, I think your questioner was asking about post-surgical pain.
Yeah.
Yeah, so we've got research evidence to suggest it's useful for pain post abdominal surgery. We're talking about electroacupuncture here, not just plain dry needle acupuncture. I think my personal experience is that you get improved tissue healing with acupuncture, which obviously we're not talking about pain, but we're talking about tissue healing because of the improved blood supply to the area. And that's just dry needle acupuncture. So there's evidence. Some of it's quite weak, and often a lot of the evidence in the literature is sort of watered down by poor quality studies. And so acupuncture gets a bit of a bad reputation as a result. So, yeah, I recommend trying it. I do acupuncture for some of my patients, but not every patient. And obviously it requires a lot of dedication for the owner taking the animal in every week.
Yeah, absolutely. And they're coming flooding in now, so I'll just try as many in as we can with the time that we've got. Do dogs develop resistance to a particular drug after time? My dog has been on Metacam for over 3.5 years together with amantadine and Librela. She tolerates Metacam well and has a blood test every 6 months, but might she respond better to a change in NSAID? We tried Gallicramp, but it wasn't so effective.
There's no sort of clinical reason why an animal should develop some tolerance or immunity or anything like that to Metacam. However, we've got to recognize that disease progresses, and so the animal might be getting worse because their disease is getting worse. And also, sometimes we find that switching non-steroidal anti-inflammatories is helpful because a different anti-inflammatory might work better for that dog. And we have probably, in the time that dog's been on Metacam, we've had at least one new anti-inflammatory licensed in the past 3 years. I'm just trying to think now. Well, Onsior, maybe that's more than 3 years old, isn't it?
I don't know.
We've got a really new one, a 7-day anti-inflammatory called Daxocox, which is an interesting one, and it's quite novel in its pharmacology, the way the drug is handled by the body. So it's worth asking to try something different, but also realize that the dog may have become, its disease may have progressed, and it might not be that Metacam's not working as well. And so might needing to sort of tweak some of the other medications. What did you say the dog was also on?
Amantadine and Librela. So she's on Metacam, amantadine and Librela together.
Yeah, okay. So the Librela, I think can sometimes take 2, 3, maybe 4 injections to show effect in some dogs. Some dogs seem to get a response from the first injection. I've had one client say they thought it was working well, but then after 7 months, not so well. We've not had it long enough to have that much experience, but I think with that dog, possibly actually its disease has got, so his disease is progressing quite rapidly, and that's where the problem is, not that the Librela's working less well. Again, we don't know if we might see some tolerance to Librela, so it's quite possible that the body could develop antibodies to the drug itself,
and just stop it from working completely in that individual.
Because Librela is what we call a biologic, so the body could actually develop antibodies to the drug. And I'm just rapidly trying to scratch my brain for information about that. I think it's something that's being discussed. So it is possible, but we've not had it long enough to really know the answer to that. The other drugs are not the body won't develop antibodies to them as such because they're not a biological substance. But the main drugs that an animal is likely to sort of develop a tolerance to, or they seem to appear to become less effective over time, will be opioid-like drugs. So tramadol, if it's working as an opioid rather than an antidepressant, which is actually, I think, how it's working in most animals. Potentially the gabapentinoids, for a somewhat complex reason, very different to the idea of opioids tolerance. What I find is dogs that get tolerant to gabapentin or appear to it appears to work less effectively over time. If they're switched onto pregabalin, almost always sort of turn a corner with it, and it seems to work better. And I don't know why that is. I don't know why that is, but that's my experience. So that's something that could be considered. Something I see with gabapentin long term is that some dogs get a bit depressed on it, and we see that in people as well.
Yeah.
People can get a little bit depressed, and there's actually a warning on the human information leaflet about depression and suicidal thoughts, and to speak to your doctor if you have these. So, there's no reason why actually it couldn't happen in a dog. So we need to continuously assess our patients as vets and make sure that they're not getting these sort of side effects or lack of effectiveness.
Yeah, no, so
we're not pumping drugs into animals unnecessarily.
Yeah. I'm trying to keep up with everyone that's there's quite a few on sort of like shockwave therapy and laser, but I think unfortunately we just don't have enough time to.
It's also something I'm not an expert in at all. You need to ask someone else, I'm afraid.
Laurie Macaulay is coming back to chat about laser therapy in more detail.
Excellent.
So definitely come and to that live, Lisa. And the last thing that I think would be worth touching on is Maria Smith has asked about Medrone V.
Okay.
So it might just be worth touching on how that works, and from a pain relief perspective, how other things might be.
So this is oral methylprednisolone,
yeah? Yeah.
As opposed to Solumedrone, which is to inject into a joint.
Yes, she's asked about gabapentin concurrently used with Medrone V, which I presume is in tablet form.
Yeah, so there's going to be no negative interactions between a gabapentinoid and pretty much any other drug that your dog's likely to be on. They got a totally different mechanism of action, those two drugs. So there's no problem at all with the dog being on both. And what you'll find is your vet won't prescribe you a non-steroidal anti-inflammatory at the same time as Medrone. So I think my one sort of caution with steroids long-term, Medrone is a steroid, is that it does encourage muscle wastage. And with our older osteoarthritic dogs, we're battling against muscle wastage as it is. Yeah. Having said that, sometimes a steroid is what you need to get on top of very severe inflammatory pain. So sometimes it is necessary, but there's quite a lot of side effects associated with steroids, weight gain, increased thirst, and various other things, which, your vet will talk to you about. But yeah, sometimes we use them temporarily for very acute inflammation, and particularly for things like autoimmune arthritis, which sometimes, a dog can have both osteoarthritis and autoimmune arthritis, immune-mediated arthritis, and also osteoarthritis can result from a historic autoimmune arthritis. So, absolutely no problem using those two drugs together in answer to her question.
Perfect, thank you. I think that's all we have time for, really. So Sheila Goldinger actually has just put in, can we squeeze in one more question, Gwen?
Yeah.
One more. So can dogs take Galliprant with fluoxetine? I've read about protein binding and haven't received a good response from the vet. She's on gabapentin, Galliprant and fluoxetine. She can't tolerate NSAIDs.
Yeah, okay. So fluoxetine is very highly protein bound, which means you have to be careful with other drugs that are also highly protein bound. So a lot of drugs are also on a non-steroidal anti-inflammatory, which is highly protein bound. So I think we need to watch out, be super careful about side effects. But there are lots of dogs on this combination. Galliprant is not a non-steroidal anti-inflammatory, but so I think the side effects are less likely to be a problem. But I would still encourage you to take up your vet's offer of regular blood test monitoring.
Yeah.
I think in reality, the dose of fluoxetine we're normally using clinically is quite low. But I don't have a lot of insight there. I think it'd be useful to speak to a clinical behaviourist veterinary specialist who's using these drugs regularly and get their thoughts
Yeah,
on
it'd be
those
really
combinations.
interesting,
But
actually.
you know, I work with a veterinary behaviour specialist, so a vet who has trained as a specialist in behaviour, like I've trained as a specialist in anaesthesia, and he uses regularly. He's using fluoxetine alongside anti-inflammatories, as well as gabapentinoids to treat dogs. So we just have to monitor. I think the risk is relatively small, but we need to be monitoring renal and liver blood parameters just to be sure that we're not getting problems there. Is probably the best way to answer that question.
Yeah, no, that's really helpful. Thank you so much. And we've had so many comments streaming through saying thank you so much. It's been such a useful live. I'm so glad I got to join. Brilliant live. Thank you so much. So really, really appreciate your time, Gwen. And everyone is just, more people are adding more comments as we start. So
okay.
Bye, so.
We'll get the links to those websites where you can look up behaviourists. And one thing that I just wanted to say is I didn't really mention at the start, but I have just mentioned, is the other class of behaviourists. You know, the gold standard is the veterinary specialist. So this is a veterinary surgeon who's trained as a specialist in behaviour, and they have the most advanced knowledge of the neurochemical changes that are going on in the brain, in the behaviour problems, and
they'll be able to prescribe as well,
prescribing, which a clinical animal behaviourist can't unless they happen to also be a vet, and prescribing very specifically for that dog's needs. I mean, some of the behaviour drugs that my colleague prescribes I've never even heard of before, and he said, but I want that particular serotonin versus noradrenaline balance for that dog. And so he's actually really individualizing that dog's medication, and his level of training allows him to do that. And he's, a vet who's trained to that level is able to make this what we call an emotional diagnosis as well, and therefore treat the problem clinically as well as with a behavioural modification program, which is what a clinical animal behaviourist is able to do. Clinical animal behaviourists also have quite a lot of knowledge of drugs, but they're not allowed to prescribe, and that's the big difference there. So just to mention my specialist colleagues, we mustn't miss them.
No, absolutely, we mustn't forget them. There's not very many of them around.
No, and they're very over capacity.
And they're very busy.
long waiting lists to see them.
Yeah, but absolutely, if you've got a behaviourist or a vet that knows a referral veterinary animal behaviourist who's a vet, that is the goal.
Yeah, there's lots of vets who've done these clinical qualifications, but they're not specialists, but they are excellent. So, and they can prescribe.
Lots of information, and thank you so much. It's been a bit of a whistle-stop tour tonight, so I really appreciate.
That's good.
It's been brilliant, and everyone's really appreciative of all of the knowledge that you've just given us tonight. So thank you. Right. So we're going to say goodbye until next time, Cam, and I hope you have a lovely rest of the evening. Bye-bye.
Bye.